Good morning. Hello, hello. Good morning. Can you hear me down the back? Yeah, great stuff. Listen, you're all very welcome. This is our first time in 3 years that we've got together, so let's have a boola bus for that anyway. Woo! And you're all very welcome. My name is Dr. Eddie Murphy, and I'm going to be your host today, and we're going to have an amazing day. There's people in the room. There's people at home. Let's give them a little wave. You can just wave at me, and they'll catch it there, so they will. And if you're at home and you're on Hop In, you can put a little thing in the chat function, and you can tell us where you're from, and through the magic of technology, it all appears up here, and I can say hello to people from home, and there's questions. And obviously, there's a great opportunity for some great workshops today as well. So, listen, you're all very welcome. Our Irish Cancer volunteers are wearing masks today. You can do what you're comfortable with. Mask, no mask, that's up to yourself. And we're really pleased that you came here today. The summer broke, didn't it? Yeah, but you're here in body and in spirit and in mind. And today we're talking about living well with and beyond cancer. So it's about community, it's about connection, it's about conversation. That's what we're going to be about today, where there's opportunity to connect with each other, share stories, share some learning, and please take that opportunity to just connect, and we will ensure it'll enrich us. And I often say, like, what's the purpose? When you leave today, if you have a question that you've come with today, then ask that question or seek out the answer to that question so you go home with more hope and more inspired. And that's what we're looking for today. So I'm going to invite up the Chief Executive Officer of the Irish Cancer Society, Averil Power. And Averil, if you come up here, and we really want you to enjoy today and experience everything. So boola bus for Averil. Thank you very much.
Thank you, Eddie, and thank everyone here for joining us this morning for this year's Living Well conference, an event that has a really special place in the Irish Cancer Society calendar. I know the last year has been really difficult for people affected by cancer, and indeed the isolation and worry continues for many. We're grateful that we're able to come together this year for what promises to be an uplifting and positive experience. And I think there's something special about us all being able to come together and share stories and experience and hear tips and advice from our speakers. It's wonderful, as Eddie said, to see so many people here with us in the room today, and thank you for braving the really wintry weather that we have this morning to get here with us. And I know that we also have hundreds more joining us online. So whether you're here in person or virtually, I hope you find today's conference interesting and rewarding. Just 30 years ago, only 3 out of 10 Irish people survived a cancer diagnosis. Today, 6 out of 10 do. And some cancers, like childhood blood cancers, and were almost always fatal in the past, are now largely curable. Others, like breast, prostate, and testicular cancer, have survival rates of over 90%. Incredible progress in a relatively short space of time. But the prognosis, unfortunately, for other cancers is not yet as positive. And our mission at the Irish Cancer Society is to bring forward the day when 10 out of 10 people survive cancer and no one has their life tragically cut short by this disease. That is why we are the largest voluntary funder of cancer research in Ireland, and you'll hear about some of the impact of that today, because research means new discoveries and new treatments, better odds and lives saved, more hugs, more birthdays, and more precious moments together. It is the driving force behind many of the improvements in treatment that you will hear about today, and the hero of happy endings. And thanks to our donors, our researchers are making progress all the time on turning today's terminal cancers into tomorrow's treatable and survivable ones. But at the Irish Cancer Society, we want to ensure not only that everybody survives cancer, but also that everybody who's had a cancer experience really thrives afterwards and can live a full life, whether they're able to put their cancer behind them or whether they live for many years with cancer, that people can really thrive and have a positive experience. We know that cancer, unfortunately, affects people in every aspect of their lives, not just physically, but also emotionally, socially, and financially. And that's why we have sessions today on a wide range of topics, including all the free supports from the Irish Cancer Society to help you with every aspect of your personal cancer experience, tips for coping with fear of reoccurrence, and advice on returning to work after a cancer diagnosis. We'll also be hearing later from Nikki Bradley from Donegal, who was diagnosed with Ewing sarcoma, a rare form of bone cancer at 16, and received her second hip replacement at the age of 26. Earlier this year, Nikki underwent rotation-plasty surgery, and she has since taken part in her first race, completing 7K at the Donegal Half Marathon last week. So I'm really looking forward. So I know we're all really looking forward to hearing Nikki's cancer story, and also hearing other examples of positive stories around. Somebody just met me on the way in and was telling me about the person that they had a conversation with this morning who 10 years ago was told that they had 2 months to live and they're still here. And thankfully, in my job, I'm privileged to hear more and more of those stories every day. So it's great to be able to share some of that positivity, to reflect on the work we still have to do, the difference we still have to make for so many people with the more difficult to treat cancers, and also to hear those practical tips. And I really hope that all of you, in your own personal way, because everybody's experience is different, finds today interesting, educational, rewarding, that you make new connections, as Eddie said, with our cancer community, and also that you learn more about how the Irish Cancer Society can help you, not just today, but every day, with whatever you're going through, whatever that you need us to be there for you with. So right now, I'll pass you back to our esteemed host, Eddie Murphy. And thank you, Eddie, for hosting this for us for the third time. The first one in person, but the third event that you've hosted for us. Thank you so much for doing that.
Thanks very much, Averil. Yeah, so normally I'm not used to weddings, you know. This feels like a wedding, really, you know, without the bride and groom. But we're going to bring up two great speakers now. And so I'm going to invite Roisin, Connolly and Sonya Lynch to come up. And as I'm inviting Sonya and Roisin, we'll have a little clap because we'll give them a bit of encouragement. How about that? Yes, super. Okay, yeah, we'll go. I'm going to sit in the middle. We never decided at the start where I was going to sit. But actually, no, I'm going to put you here if that's okay. I'm going to hide it behind this one. And Roisin Connolly is a medical oncologist in UCC. And we're going to talk about a wonderful survivorship program. And Sonya is patient advocate, Irish Cancer Society, and we're going to have a little chat about this. And I think you'll find there's some interesting about the whole area of survivorship, which is an interesting concept in itself. But Roisin, if you can tell us a little bit about yourself first.
Thanks, Eddie, and thanks so much to the Irish Cancer Society for the invite to be here today. Really delighted to be hopping on the train yesterday from Cork up to Dublin. So I'm a medical oncologist in Cork University Hospital, and I take care of patients there with breast cancer of all stages, early stage and more advanced stages. And I also have, as Eddie said, a position with the university, with UCC, which has a research component. And I think we're going to talk about some of that research today.
Yeah, that sounds really super. So you're busy, hey? You're busy. You're like split between the university and the clinical side. But fair play, I really appreciate you coming up today. Thanks so much. And Sonya?
Yep.
Really appreciate you. Now, myself and Sonya didn't know this, but we have a friend in common. It's typical Irish, isn't it? Sonya goes, oh, where are you from? And I like, where are you from? And then we figured out that we have a friend in common who trained as a nurse. So Sonya trained as a nurse. So.
When I trained as a paediatric nurse, I met Eddie's friend. She's one of my very good friends. So
there you
Ireland
go.
is small, yeah.
So she's a runner, and I follow her around the place. So Sonya, tell us a little about yourself. What brings you here today?
So I'm 47. I live with my husband and my 3 children. I've been to many, I suppose since 2014, I have been to many Irish Cancer Society conferences, but I've never actually been a speaker. I've been in person and online, and I have gotten a lot from them. The reason I've been to these conferences is I was diagnosed with primary hormone-positive breast cancer in 2014, and then that followed with the metastatic diagnosis in 2018. So I've got involved in as a patient advocate for the LISA trial, the Women's Initiative, because I felt through my experience, I suppose there was different areas going through primary and going through metastatic, different areas that I felt I could give feedback on, and areas that I felt could be improved, or areas that I felt where women would need support. And that's really where it came from. So I trained as a pediatric nurse, and then in recent years I gave that up, and I just work at home, or so I do a little bit of the advocacy, and I'm a stay-at-home mom, which I love at the moment. So I think from my experience of a pediatric nurse, I kind of brought that a little bit in as well to some of my patient advocacy suggestions.
Yeah. So and there's a partnership approach here, really, isn't this? This is a sort of a change, I think, where sometimes often research is done on people or done to people, but now we're looking at with people with lived experience. I think this is really important. Maybe you can take that up.
Yeah, I think I agree totally. I think, I suppose in the past, clinical trials were developed and research projects were developed, and all of the decision-making around that was with the researcher, but over the last decade or more, it's become clear that we need to be involving those who are experiencing in this case, cancer, in the decision-making about what a project will be. So for the work that we are doing in Cork, we have had patient advocates, including Sonya, involved literally from day one. And that was encouraged by the Irish Cancer Society, and we were delighted to be able to identify people in our region who would work with us on how this project would look and continue to work with us as we move forward.
And then this brings us to this survivorship and the discussion of survivorship, which is, it's not new, but it's certainly a growing area. Mm-hmm. And maybe, would you like to talk about that a little bit?
Yep. I suppose survivorship for me, I think is vital for patients. I think initially when you're diagnosed for a family, it's a crisis and everything is spinning, I suppose, in a sense that you're being thrown treatments, you're being thrown, you're outing the fire in a sense. And then I suppose as soon as you have, your main treatments, then when it starts to simmer, then you realize, okay, where do I go from here? What happened there? It's like you just come off a roller coaster and you go, okay, and then you try to get your life back, I suppose, and you try to adjust changes.
It's huge.
So I think support in that phase is really important. It can be very lonely, it can be very isolating, and you feel, you've had the treatments you need, and then you just, there's a bit of a loss as to where do I go from here? How do I, where do I go from here, basically? Because I think you need the support with a lot of areas that a lot of years will come up for years after.
And I'm very conscious that people at home or people in the room, we've all different stories, if that makes sense. And everybody's has a unique pathway. And you talked about that initial phase and the whole shock and tsunami that it impacts. And obviously there's the individual and the family members. And for myself, and people know this because I would have talked about my wife and of her permission, who has a significant cancer and living with cancer. And I sort of think of like a pebble that goes into a pool, and you have the ripple effect. Yeah. And sort of like I suppose myself and the two boys would be on that first outer ripple from my wife who's experiencing it, and then family members and stuff like that. So there is ripple, and then there's this, in psychology we often call it like an adjustment period, like a transition period, and that can be hugely significant. Yeah. This refining yourself, I think, is quite interesting. That and then you've spotted gaps
Yeah.
And I think this is the gaps.
Yeah.
And you've come in to look at some of these gaps, isn't that right, with the program?
Yeah, that's right. So I suppose, it's been recognised internationally that we need to go beyond the norm, when we're looking after patients. We don't want to just be focusing on, the next step, the treatments, the tests. We want to be looking at the whole person. And that's really what the area of survivorship is helping people live the best they can, having control of symptoms, good quality of life, dealing with fears and emotions that come up. So I suppose we were just delighted a few years ago when the Irish Cancer Society, recognised that there were gaps and asked for a programme to be developed. This one particularly focusing on women with a history of cancer. And so our team came together in Cork to propose a project that ultimately was funded. The goal of this is to provide an extra layer of care for patients beyond the routine in the clinic with the doctor, because we know that there are many needs that a patient and their family have, and what we're doing is we're trying our best to identify those needs and issues and to manage them, we hope, in a better way. We have this project up and running in Cork, and it's going very well, and I'm happy to...
Yeah, so we're going to talk about this project.
Yeah.
But you were involved in writing a letter for this project as well, is
Yes.
that correct? So you just to get a sense of the partnership approach, just really... And I think this is the thing, when it comes to healthcare and any of our healthcare, I think, and modern healthcare and modern professionals want a partnership approach. They don't want that traditional talking to. They want this partnership approach. I think it's invited. So I'd invite you to think about that relationship and having that partnership approach. And you wrote this letter.
Yeah, so I suppose noticing the gaps through my treatment, I knew there was areas that needed to be, looked at, developed, but I wasn't sure how I would go about that, and especially with exposure. I suppose I didn't want to be public, or I didn't want to be going on the radio giving out about, different areas. So this, in a sense, gave me an opportunity to put down in paper on writing and, the areas that I thought were important. So my own doctor just happened to ring me and ask me would I be interested that the Irish Cancer Society were offering a grant. So there was a proposal, and as part of the application, it needed, obviously, oncologists, different teams to explain why they needed these services and why these services were so vital. And they also wanted a patient's perspective. So I did that, not knowing where it would go. I just said, look, I'll send my letter. And then it got approved, and they said, okay, you've proved to us that we need these services. And that's how it started. The first meeting was in the COH. It was before COVID. And I couldn't believe the amount of people who turned up on a Friday morning at 8 o'clock on a January morning that wanted to make the services, wanted to improve the services. These were people who were already busy. Some of them came in, started at 9, they came in at 8, they came in with their coffees in their hands, they sat on the windowsill. The amount of nurses that turned up because they recognised and they wanted to make a difference and improve these services for their patients. So that alone gave me kind of an insight into the other side of it, not just the patients, and how much work it takes to get involved, to organise these meetings amongst an already busy schedule. So it's given me a very good insight into what goes on the other side and how much work it takes and how much money, as in the funding. If the funding didn't come from the Irish Cancer Society, this wouldn't have happened. And that's where we need to prove that this is needed, that hopefully the trial will come back with very, very positive results, and then maybe we can go and prove to the government that this being set up long term would be a very good support for patients, and that long term it would be cost effective because it would, it would prove better quality of life, better survivorship, and it would help people get on with lives, whether living with cancer or not, from a survivorship point of view.
And I think to do that, given often the fatigue and the energy levels that are, I commend you for that, because often to take that energy and to give it to others can be hard at that stage. So I really do commend you for that, Sonya. And maybe tell us a little bit about it's a LISA program.
So this is I suppose what we call a nurse-led clinic. that we've set up in CUH.
So you can't beat the nurses, right? No. Of course, before, people mightn't know this, but before I was a psychologist, I was a nurse. And then they often think, sure, he was a psychiatric nurse. No, I was a general nurse. I worked in England for 10 years. That's why I wear a real nursing hat on me at times, and say, advanced nurse practitioners, clinical nurse specialists, the general nurses, right through the system. And so it's a nurse-led service.
A nurse-led service, and you're absolutely right. We couldn't take care of our patients with cancer without the support of our nurses, and we're lucky in Ireland that there's a big focus on clinical nurse specialists to support us, and it's going that extra mile in terms of care, support, communication. But for this specific project, one of our fabulous clinical nurse specialists actually decided to take on the role of a research nurse for this project, and one of the many people involved. We have dietitians involved, we have people who are in charge of administration, data collection, etc. And essentially what we're doing is we're identifying women in our clinics who have come through a lot of their treatment for breast cancer and gynecological cancers, the earlier stages where they have their diagnosis, then they have their surgery, they may have radiation, they may have chemotherapy, and then they're going on to the next phase, the sort of the follow-up or surveillance phase. And we're discussing the clinic with them, telling them a little bit about it and offering them if they wish to participate. And essentially, these women are then having a special meeting with the nurse and the dietitian, where they run through their treatments, their diagnosis, and they give them, a survivorship plan, where all of the information is summarised in one place for the patient, and then they have that, and that's their reference. And
there's an interesting piece, because I know we were talking a little bit earlier on that through the sort of monitoring, there's quite a faster pickup, isn't there? And maybe you could, and some of the symptoms that would be nuanced get responded to earlier. Maybe you want to take that.
Yeah. So when the women first meet with the team, they do a set of questionnaires to try and assess, well, where are we at the moment with symptoms, with issues, be that a mood issue, a fear of recurrence issue, and then what we're doing is we're studying two groups of women, and one group of women are every 2 months entering data online, into an online system about how they're feeling, what are their quality of life issues. And the idea then is that messaging is going back to our nurse, to our team, and they're picking up potential red flags. And they can sort of see over time, they can track how patients are feeling. Are there new issues coming up? Are symptoms improving, or are they getting worse? And then they're reaching out and saying, we noticed that there's something not quite right here. Tell us what's going on and how can we help you? And I suppose the sense is that we're being more proactive with trying to identify issues and help women in this situation to get on top of the issues.
That's really powerful, because the impacts on, particularly if someone's got anxiety or fear, and just to know that we have a couple of really good workshops today. We've fear of cancer returning, that workshop's coming on here, and there's different rooms and there's different workshops, and if you're at home in our audience as well, you can come into those different workshops through the power of modern technology. And we've another Live Eating Well, so I have really good workshops today. It's just, please stay in and tune in for that. But it's that proactive piece, because that really impacts on quality of life. It's about quality, isn't it?
Yes, it's definitely about quality of life. And I think not just the cancer patient, the family, as we were saying, relationships, I think, it can be very hard on partners. And I think some issues that come up with regard to menopause, with regard to hormone treatments, they can have an effect on a relationship. So even addressing some of those issues is a relief for a patient. Oh, I thought I was the only person who had to do or had this. I thought I had to just put up with this because I'm lucky to be alive. I thought that this was just part of it, where in actual fact many people have gone through it. It's just been a silent suffering. So I suppose even addressing an issue, I find, makes half the difference. It's just like a weight off your shoulders to be able to say it, and then the experience that the nurse will have will be huge coming back as to the different adjusting your life to post-cancer, really.
Of course, and it's really powerful. So all the skeletons are taken out. We talk about relationships, there's talk about sex, there's talk about all the impacts around menopause and stuff like that. So really powerful conversations. And sometimes, of course, I would be a psychologist talking about sex. That's what they say that we do, don't they? But they're important, because if they're important to you and to your family and to your relationship, to your life, they're important and if these things were not spoken about, and this impact on quality of life, and impact on survivorship, and impact on the individual, and having a space to do this work, and tell us about because I like the idea too that it's a women's only group, because I think that's really powerful. It's important. I think sometimes, like even though I'm talking up here, men are like sharks and women are like dolphins. So you're all dolphins, right? Because you're all here together. You're part of this tribe. But sometimes it's very difficult to get men in a room to talk about sort of stuff. So I think it's really powerful. There's a community, a tribe there. Maybe you could give us a sense of that.
Yeah, I think women and men and people with different types of cancers, there's unique needs. So for our initial project, we have focused on the breast cancer and the gynecological cancer, but clearly we need to do more. We need to be looking at these types of support services for all cancer types, for all patients, and to be able to assess the unique needs of the individual. We have been really lucky in two ways. One is that we have been able to have the clinic reach out also to Galway, so our colleagues in Galway have also been participating, but also some of our team in Cork have also gotten funds to start a men's initiative. And that is with some of our colleagues who take care of patients, especially with genitourinary cancers, such as prostate cancer. And so really there's a lot of work to be done, but we're really excited about this new phase with the men as well, because as you say, there's different needs, there's different ways that men maybe communicate, and they have different symptoms and...
That's great. Yeah. So there's an involvement, and like everything is about standing on the shoulders of the previous work that's gone before us. I think it's really powerful. But yours early phase, like you're the first study in Ireland, isn't that correct?
Well, for this specific question, this is a pilot project. It's a 200-patient project, and it's a first step. And yes, I believe it's the first of its kind in Ireland. But there's many areas of research in survivorship, and I hope that really there will be more and more of this type of work going on around the country, and then ultimately leading to this being almost a standard of care, because really every patient deserves this type of approach.
It's very powerful, and it goes back to your spotting gaps.
Yeah.
You're getting an invite. You're writing this letter, this shaping of this program. I think it's really powerful, and I suppose it's an invitation to other people, if they have that energy, to start maybe becoming patient advocates, getting involved in the research side of things, because research can't step forward now without patients on board. I
think after COVID, or during COVID, I suppose, there was a lot of calls online, which interlinked with Dublin, who are also doing their own project which we're learning a huge amount from them. They're learning a huge amount from us. What they have set up is amazing also, and that was both funded by the Irish Cancer Society, and they were basically, I suppose, studied on gynecological cancer, focused on more so. So both will interlink, and both we'll take from them and they'll take from us, or Roisin will, it's learning from each other. But I think before COVID, it would have meant a drive to Cork, which is very hard to schedule. The doctors have already got a very full-time job without extra meetings. So I think that was one benefit that we did have from COVID, and it learnt that we can link together better.
Roisin, the evidence for this survivorship, talk about that a little bit, will you? So, because I think people will be very interested in the room about knowing that survivorship matters.
So I suppose globally there's a lot of work going on in the area of survivorship, but there's still a lot to learn. what exact interventions are best for patients, what exact treatments are best for some of the symptoms that develop. For example, many women will experience hot flashes, and we don't always know if the treatments that we have for that are the best. So really, these survivorship programs can be running in many cancer centres around the world, but they can each take a slightly different bent. Some may be more focused on young women, some may be more focused on patients with metastatic disease, some may be more focused on men versus women. I think ultimately, survivorship care is felt to be something that we should be offering to everyone. It's part of international guidelines, but how we implement that care, how we do it the best we can, is where research can help, to bring us to the next level.
And when I think about that, I think it's a really interesting concept. Just that I've heard the word survivorship, but that survivorship care, when you put that beside survivorship, I think of the Irish Cancer Society, because I think the work of the volunteers, the work of the drivers bringing individuals to their appointments, the work of people going out, fundraising. There's care and survivorship in all aspects of what the Irish Cancer Society does. Actually, when I think of the two words together, it just really struck me that it's almost like a fishing rod, and the eyelets of the fishing rod line up for the person who's collecting money on Daffodil Day, to the researcher, to the patient advocate, to the volunteer driver, to the work that the peer-to-peer support, to me, is all about survivorship care. And as Averil said, about creating better memories as well in having other days.
Yes.
Really powerful stuff. I think that deserves a clap for the Irish Cancer Society. I think, It's just when you link them two together. So, where do you think this is going? The future. Where would you like to see it? If I had an unlimited pot of funding and you couldn't go off into a lab with all of the funding, okay? Where would you like to see some of this going?
I think one thing that's really important to consider is the role of the community in managing the care of patients with cancer. We don't want everyone to have to come to hospital. That's where we've started. We have our clinic in the CUH and in Galway running, and as Sonya mentioned, the team in the Mater Hospital have a separate programme running. But I think it's becoming more and more clear that we need to be looking to the community as well, because people are living in the community, and can they get support within the community? So I work closely with Professor Josephine Hegarty, who leads a survivorship research program from UCC, and she has many colleagues there with many different skill sets. We're going to be working on the next phase now, is to see, can we bring some of this, maybe we identify the patients in the hospital who have the needs, and then we bridge into the community to see, can a lot of the care take place in the community through the cancer support services like Ark House, who've been hugely supportive for us for this programme, and others in Kerry and Waterford, for example. The GP practices, again, the nurse specialists in the GP practices. So I think moving out of the hospital into the community is one big thing we need to do, and also figuring out better use of technology, and figuring out, can people use their mobile phones to support themselves? Can they do it online? Self-help, If people can identify issues themselves and manage them themselves, they may not need to come to the hospital. They may not need to call the nurse. So there are some of the things that are of big interest to us, and really looking forward to the next phase.
Yeah, that sounds fascinating. So, and I often think people live in communities. They don't necessarily live in hospitals, don't want to be in hospitals, really. And providing the service in the space that the individual is living becomes really powerful. And I think peer-to-peer could be a real key to providing that emotional support as well. Sonya, where would you like to see this evolving into?
I suppose, in one sense, because of the incidence of cancer, learning to live with cancer, it's becoming a little bit of a norm. It shouldn't be, but it is becoming, well, it is a norm for me, I suppose, because it's my life. But I still live my life, and I still bring my kids to school, and I do, and thankfully all the treatments that have been available to me have made that possible. So I think supporting women, and not just women, everybody that has had cancer, because whoever I think they live with this, it affects them, and it will affect how I am supported, will affect how my children will grow up to their reaction to cancer, and when they're older, I suppose how it has affected them, and I hope it will be in a positive way, that they may even be able to give back. So I do think, supporting long term, and I think going away from feeling like a statistic. I suppose sometimes when you're diagnosed, you think you're just a statistic, whereas in actual, you have an identity, and you could have two different patients with the same cancer, and they have very different needs. They have very different. And I think empowering women with the right information. We can Google and get all sorts of strange information, all sorts of statistics. We don't, the worst. But having the right information available to us is very important, and having the right, I suppose, I think the more patients that give a voice, the more trust we will have. It's not about wanting to be on the stage. It's not about wanting to be, it's not about the person that shouts the loudest. Sometimes the quieter voice is actually the one that the team at the meetings will say, actually, that's a very good point. And, it doesn't have to be the loudest point. So I think patients are becoming more active. And I think I'm lucky to have such a good relationship, because it started, I didn't know how it was going to turn out, but they listened to me and I listened to them, and we learn from each other. And I think it's good to always be open to learning, and always, hopefully, learn to live with cancer, I suppose.
I think it's a lot powerful, this co-creation, but what I'm hearing there is a little bit about how your identity is so much bigger than your cancer. How you, the person, is so much bigger.
Yeah.
And it sounds like there was a period of time when that was bigger, and now you're clawing back your life.
Yeah.
It
doesn't define you. If anything, it will teach you a lot. There is losses, but I have found I still love my life despite cancer, and there's a lot to gain from it. It definitely puts you in a different direction, and sometimes that can be really hard. It can be hard to accept the losses. It can be hard but learning to be more flexible, but the support has to be there to do that, because otherwise you're isolated. And I think meeting with the nurse, in a situation like that, gives you the time to have to express yourself. That doesn't happen in the hospitals. And I think the community is a fantastic idea.
I think it's important that, because also there's things you want to say and leave it in the room, as it were, and not necessarily say it to your nearest and dearest.
Yeah.
And that can be very powerful to offload as well. So it can. So it's been fascinating, really, isn't it? This all, I'm really struck about the letter you wrote, your insights, first of all, the gaps that you identified, and how this evolved into, and you then, you're you want to talk about the team as well, Roisin, I think that's...
Yeah, I think, there's two of the team members sitting here with you today, but this was a huge team effort, and I suppose we talk about the stakeholders and the team that are involved. This would not have been possible without support from our hospital, which is essentially the health service, and the leadership there, and a lot of our medical disciplines in the region. They all got on board. They said, yes, we'll help you, from medical to our psycho-oncology team and our allied health team. So, we're linking with our physios, our dietitians, the support of the National Cancer Control Programme in this, the funding that comes, really so many stakeholders to make this happen. There's the core team that actually execute the project, our research nurse and that team. Then there's the broader team, the patient stakeholders. But everyone has really, since 2019, been working so hard on this. There's multiple layers to it, but it would not be possible without all those people.
Super.
Yeah.
And Sonya, I'm going to leave the last word to you.
Yeah.
So, is there anything you want to say? Or?
I suppose from a patient advocacy point of view, I never, the times I went to the Irish Cancer Society conferences, I never aspired to be a patient advocate. It didn't happen like that. It just happened. It wasn't something that I ever thought I would get involved in, but I suppose there's more and more, and I think there's a lot more support now because there's a lot more other patient advocates, so it takes the pressure off one patient advocate. So I think alone. I think for me, I suppose the fear of public and the fear of privacy, you know, I suppose for my family, and that was something that would have probably stopped me. I felt it was just for people who were outgoing or people who were, you know, willing to or had experience in public speaking. But like, this is new for me. I do, you know, this is new for me, but I suppose because I've been with the LISA team for so long, they've given me the confidence to say, you know, what you're saying does make sense, and, you know, and they've given me the confidence to speak up and to actually want to make things better.
Say there's somebody here now in the group or somebody at home, and you can always remember to get your questions in and hop in. If they wanted to go down the pathway of patient advocacy, how would they do that?
I think speaking to your own doctor is very important. There's different areas that are involved. I think you have to give your own limits, what you're comfortable with. You know, going into patient advocacy doesn't mean, you know, you sign up and then the next day you're going to have your photos taken and you're going to expose your, you know, I think for that, I think it's a little bit, it can fear that. Whereas I think there's projects around, there's trials around that you can get involved in, and you can have your own say, you can say what you're comfortable with. For me initially, I wouldn't have liked to sign up to anything that was, because with the unpredictability of cancer, I didn't want to put pressure on myself because I never knew what was ahead a few months later. So this gave me the freedom to do it and then I got more and more involved, but that was by my choice. So I didn't want to take on any project that was going to put me under pressure, because that's the last thing I needed. It just evolved itself and it just became comfortable. And what I was learning as much coming off the calls or from meeting the team, as they were, you know, odd bits that I'd learned from me. But my experience is only limited in the sense that I know what it's like to lose your hair, I know what it's like to have young children. When I first diagnosed, I know now what it's like to have metastatic, I know what it's, you know, but there's other people who have huge amount of experience on other areas, what it's like to be single with cancer, what it's like to, you know, have fertility issues because of cancer. So all those people's voices are really important, and I think coming together in a confidential, in a safe space, I think is what's important, to be able to voice your opinion, and there are people there to listen. So I think, your own doctor could advise, or any of the groups that you find interested, link in with them and just say, look, if there's something going on in there, I'd like to give my voice. There's an awful lot of research at the moment, doing research. Sometimes on social media, you'll say they're looking for people, and you give what you want. You don't have to sign up for something. Okay. So I think that's the important part, really.
Well, listen, thanks so much. Very interesting talk. Can we hear for Professor Roisin Connolly from UCC, and for Sonya Lynch, our patient advocate. Thank you so much. Really appreciate it.
Thank you.
So we might take a chance. Is there a question or two? And then we'll, does anyone want to ask anything, or is there any burning questions there? Oh, very quiet in the house today. Well, we can do some questions after. Is there any questions that people want to ask? Any thoughts? It's always yes, we have a hand up here, so we'll get a mic to you there. So we will. And you super stuff.
Hello.
Hello.
You can hear me all right?
Yeah.
Paul McClune is my name. I'm from Donegal, and I've been attending cancer conferences for 16 years, and I've had repeat cancers. And previously, I worked as a hospital manager many years ago, so I'm kind of speaking on both issues. And Sonya hit the nail on the head when she said, and she said it twice, Sonya, where do you go from here? When you get your treatment, what happens next? And this is where I think the Irish Cancer Society and what this session is about is absolutely vital for patients, in that the hospital can't give you that kind of support. But I would put it as serious an issue that I think my survivorship is all about the Irish Cancer Society and what they did for me. And Roisin, you said about online and that, but actually meeting other patients and reassurance in that is really brilliant. So I want to congratulate you on the session, and it meant a lot to me, and I think on behalf of all patients around the country, the Irish Cancer Society are playing a blinder with regard to survivorship, and they're filling the void that the HSE just can't provide it. And I just wish it was recognised and maybe give more funding for it, because it's a service that's been provided rather than a gap that's been filled. Thank you.
Thank you very much. So Paul, if I could summarise that for our audience at home. If you have a question or a comment, thanks so much, put that up. Paul, who's a cancer survivor and ex-hospital manager, talked about the work of the Irish Cancer Society. I'm repeating myself now just for the people at home because they can't hear that, but I'll just say it for them. And the compliments towards Sonya and to Roisin for the work and the Irish Cancer Society for filling that gap. But it's a service, and maybe as a government and funding that they see that maybe this is an area that could be funded. Indeed, it should be funded. Thank you. Any other questions or thoughts there? I put my hand up like that. There's a big light in my head. Anyone? Okay, well, I've no doubt people will be working their way towards you guys. This is what happens in these conferences. They'll, once you put yourself up there, I'm going to thank you, and I'm going to get our next speaker up on stage, so I am.
Thank you so much.
So, thank you so much to Sonya and Roisin, and all the way from Westport, County Mayo, I'm going to welcome Paul Coghlan up, so I am. And Paul, you're very welcome. Paul's nearly going to jump up here. Let's go, Paul. I'll bring you over here. And Paul is, so we're going to talk for a period of time. And again, thank you for your attention. Just before we get talking to Paul, I'm going to ask you to stand up and to give yourself a stretch break, right? Look, a stretch break, right? Because sometimes they say sitting is the new smoking. Isn't that right, you know? So standing is the new, and you can have a little sway. And don't worry, I'll get you to do a river dance later on, and I'll get you to do a set dance later on. I'll get some music in the house. So do you know who you're beside? Do you? So say hello. You can give a little fist pump if you want. You can do the hellos, yeah. And we get the nice energy in the room and stuff like that. And so you're also welcome again today. So isn't that great? We're going to sit down. We'll call Paul up on the stage again, and then we're going to talk for about 15 minutes or so. And then this plenary session is going to close. And I only learned from Breda, from the wonderful Cancer Society. Breda, I said, do I have to say plenary session? I said, do I have to say plenary session? And I don't even know what that word means. I didn't actually, until Breda told me it means when everybody gets together. So that's what we're doing, a plenary session. I learned yesterday. This is my first time doing this, by the way, you know. So and we're going to talk to Paul. Welcome, Paul. Okay. So there's a form of therapy called Gestalt therapy, where they have an empty chair, okay? And so this is where you can talk into the empty chair. But I'll tell you about that therapy style another day. So, Paul, you're very welcome.
Thanks very much.
Westport man.
Proud Westport man, of course, yeah.
Any Mayo people in the house? Yes, come on, let's have ye. You can't beat it. You can take the person out of Mayo, but never the Mayo out of the person. There's not what to say. And we hope to welcome all our Westport and Mayo people from online as well. So, Paul, tell us a little bit about yourself.
As I said, I'm a proud Westport man, delighted to be here, and I'm here because of the Irish Cancer Society and the research they've done over many, many years. I am a father of my own daughter, one, and my partner, Linda. I've got two stepdaughters, so in my house there's 4 girls, so I don't get time to speak, so this is a big opportunity for me today, to be honest. I'm very, very lucky. I am living well with and beyond cancer. I'm grateful to everybody associated with the Irish Cancer Society, the services they provide and the supports, and it's an extraordinary, really is an extraordinary organisation.
Very good, okay. Thanks you very much. And Paul, I suppose that takes us to a little bit to, well, before we get to that, you say if there's 4 girls in your house, right?
Yes.
But you seem to get away a bit.
Yeah, we had this conversation earlier. Eddie was delighted to hear that I golf.
I wasn't delighted to hear you golf. You told me you golf.
Yeah, I play some golf badly. I'm a sports person, so I involve myself in all sorts of sports, and that's definitely a pastime. I get to watch a bit too, so maybe actually my life isn't as female dominated as I thought it was, but yeah, it's
so
a good life.
Sport's a passion.
Yeah.
I'm always interested, so in our lives, when we talk about living well, is what gives us pleasure, what gives us meaning, and what gives us engagement. And I suppose, have a think about that, right? I'll come back to you with the pleasure one in a minute, right? But if I gave everybody a 99 cone here, would that be nice? Yeah? Go down well? Yeah? You can have sprinkles and chocolate on it. Now, if I gave you a second one straight away, no. So sometimes pleasure is short-lasting, needed, but short-lasting. But meaning and engagement is often the dynamo to our well-being. And one of the things that in 2018, something changed in your life, and then you got meaning and engagement from that. So let's go back to that.
Yeah. I mean, early 2018, I was mentally, physically, and emotionally in a really great place. I'd been starting training a couple of months in advance of it. The training was pretty hard, but me being a resilient Mayo man, I wanted to push myself harder and harder to get fitter and stronger, which I achieved, thankfully. In early to mid-April, I began to feel a little unwell. Nothing major, sore throat, a mouth ulcer. And the reason I went to my doctor very quickly was because I was getting frustrated that I couldn't train to the same level as I was training previously. And so I went to my doctor, and after a few blood tests and a life-changing moment on May 10th, everything changed. I woke up with a black eye, which was a shock to me. My girlfriend doesn't usually swing her arm across and punch me or anything, so it was a real shock. And ironically, that happened to be on the date of my father's anniversary mass, who we lost to cancer in 2013. I began to really struggle with swallowing water, etc. On May the 11th, I was brought up to hospital in Galway, rushed up, and I was diagnosed with what's called acute myeloid leukemia, which is a rare and very aggressive blood cancer. I was 39 years old when I was diagnosed, so I would have thought too young, but cancer doesn't have an age, so
no way. Big shock.
Yeah, massive shock. Yeah, huge. Following that was some of the biggest uncoverings and learnings of my entire life. My diagnosis was not good, and my initial thought and my initial action was I started crying, and I cried quite a lot for, I don't know, maybe 30 minutes, 45 minutes. My initial thought was I need to focus on something to get over this, when I was told that maybe, just maybe, there wasn't going to be a positive outcome to this. And that outcome at the time was my daughter, who was 7 years old. So I had to learn quickly, and relying on the medical services of this country, nurses, doctors, and the supports the Irish Cancer Society give, has ultimately changed me as a person and my life. So I'm just exceptionally grateful for that, I really am.
Okay. Yeah, very powerful.
This is thirsty work, Eddie.
Thirsty work, don't worry. Take a drink.
Thanks very much.
Yeah, it sort of brings you back a bit, doesn't it, when you talk about it? I mean, it's not easy to talk about this stuff.
No, I'm quite fortunate. I'm an open book. When I've spoken to a number of organisations and groups, football teams and stuff, I often explain that my biggest go-to at that time to bring me to a level where I could make a right choice was I just cried, and I cried an awful lot. And I cried because it was my way of expressing that negative feeling. I needed to be strong. My whole thought was I needed to be strong for the people around me. I didn't want them to see weakness, because I needed to protect those people, where really, in hindsight, those people protected me and kept me as positive as I can possibly be. But I am an open book, and I speak about this very openly, and if I can share any insight or a lesson, or if I can just listen to anybody who faces any adversity, even outside cancer, that's what it's all about. It's open and accepting every bit of nugget of advice that you possibly get from anybody who faces any sort of challenge. So
those learning points that you're talking about, maybe take us through some of them, or...
Yeah, I mean, for me, I guess we often hear the word resilience, and I had to learn a lot about my physical, mental, and emotional health, because they were all challenged very, very quickly. So within the space of 3 weeks, I was diagnosed with a cancer that ultimately shot me down. I was in hospital for six months, and you're without your daughter, you're without your work, your routine, your friends, playing terrible golf. Everything just changed dramatically, and that's where I had to reach into my girlfriend Linda, my brothers and my mum and some friends, just to kind of not let me forget that there was a focus, and the focus is always forward. That we needed to look forward. We needed to set small little goals, and those small little goals can be so small it might mean nothing to you or anybody else, but walking 10 or 20 steps became a chore. So that was a milestone. And then the CLAD Award in the University College Hospital Galway, 7 laps is a kilometre. And myself and another patient at the time took this challenge on, and we had a few little stumbles along the way that we never told the nurses about. And where it was 4 laps in, will you manage another 3? I will. And then you'd fall over and sit down for 20 minutes. But the idea was we were working as a team because it was a goal. And when we achieved that, it was like winning the lottery on that very first time. We probably slept for 2 days after it, but we did achieve it. So that was definitely the important part about it. Was we had a focus. That focus was to be a positive outcome. So we were delighted.
So those small goals, those marginal gains, incremental steps, do you still use that, or do you still think about that? Or
every single day.
Okay.
Every single day. Something that might have frustrated you previously is now more manageable. So work that might have frustrated you previously, you can now step away rather than getting frustrated. I use affirmations every single day where I want my girlfriend and my kids to be happy and healthy. I want my mum to love me more than she loves her new dog. That's a new one. But there are small little things that I use every single day, and I believe they've led me to a far better person. Of course, we all have a bad day, but as long as we're forgiven a few bad days, that's okay.
The thing is, now you're giving back as well. Tell us a little bit about the volunteering and the work.
That's incredibly important for me, to be honest. Over many years, I've been part of organisations that have raised some money for the Irish Cancer Society. We've done the Relay for Life, and we had an indoor beach party many years ago, and recently we did a couple of star jumps every day for the month of May. So there's been quite a lot of money raised over the years, and that was my way of giving back previously. Now, I guess my focus has changed a little bit. I will always fundraise, I'll always support the best way I possibly can to help everybody else, really, and that's by creating some funds for research and the supports that the Irish Cancer Society bring. And for me, becoming a volunteer, I finished the course in February, it was really important, and it's because...
That's the peer-to-peer course.
Yes.
Yeah.
I just wanted to know that there are people out there who will listen to you, and more often than not, people want to just talk and you listen to them. And being a person who's been through so much in every aspect, that might just be enough for those people to have one phone call with you, might lead them to opening up themselves to family and friends. And if they need a second call with another volunteer, that's also incredibly important. But for people to know that this service is out there and that there are people on it who have faced cancer, and to a certain level, as much as cancer is to each every person is individual, if they can speak to somebody who might just be able to understand a bit more than someone who hasn't faced cancer, I think is powerful. I really do.
It's very powerful because people often, you're further down that pathway. People often who have entered that pathway often seek to speak. The peer-to-peer support is so powerful. It's incredibly powerful.
Yeah.
So it's very
powerful. Anybody in this room who is going through cancer or anything, ring, make that phone call. It's not embarrassing. It's actually a compliment to you and your families, because you might not open up as much to somebody person to person, but you absolutely will. I know I have done over the phone. It's often easier. So it's a powerful tool to have. The Irish Cancer Society really provided the service, and it is quite incredible.
And so I just want to take a little moment just to talk a little bit about volunteering. People that volunteer, actually the psychological evidence would show that they gain more than they get, or they get more personally from volunteering. It's such a powerful thing, and I want to give a big shout out to all the Irish Cancer Society volunteers. We have them here today. We have them around down the streets. Our peer-to-peer to support, the drivers, all the Irish Cancer Society volunteers. That it's such a volunteer-based organisation. I think it's really powerful, and it's what I think connects Irish society a lot is the volunteering that goes on in society, and particularly with the Irish Cancer Society, really powerful stuff. Paul, thank you so much for sharing your story today. Really appreciate it. Best of luck with everything, and keep those small goals. I think they're fabulous, so they are.
Absolutely. Thank you.
I think you could write that book. Thank you. Okay, folks. Thanks, Paul.
Thank you.
Here for that. So we're going to, that's the end of our plenary session, so it is. And we want to thank you very much. We're going to break up into our workshops. If you check out your lapels and your tickets, there's different workshops in the different rooms. So you can pick and choose. It's like pick and mix in the shop, right? You can go and you can have a bit of this and a bit of that. And so we're going to take a little moment as we're going to move into the different rooms and stuff like that. And can we have one last clap for all our speakers this morning? And thank you so much. Take care, and we'll see you in a few minutes at the workshops. So if you're hopped in, and we're going to give you a shout later on. Thanks so much then. Bye now.